Some residents want the City of Manila to implement a scheduling system for its vaccination program. Long lines have greeted Manila's inoculation sites over the past few days, with some vaccinees even camping out just to make the cut. Let's discuss that and other issues with Dr. Rontgene Solante, Infectious Diseases head of the San Lazaro Hospital, as well as a member of the vaccine expert panel. Good evening, Dr. Solante. Do you think it is high time for Manila to do away with this first-come, first-served system?
One thing good here is that everyone is really interested now in vaccination. But we really have to make the process that also will accommodate a lot of them, but not with the compromise or uncompromising situation. We are in danger of the transmission of the infection if we are crowded in that particular area. And that's why I don't totally agree with the first come, first serve basis. It has to have a schedule so that everyone will be in a smooth and systematic way of getting the vaccine.
All right, so in your opinion, Doc, do you think that the people actually lining up is enough assurance that no vaccines will go to waste, at least in the city of Manila?
When you have this master listing and then you schedule a group of number of people who will be getting the vaccine, there is always a buffer number of people that will also be possible substitute if there will be dropouts coming from those who initially listed.
Mm-hmm. Well, I think the argument with some LGUs, I think this is also happening in the city of the Caloocan, is that people or the uptake for online registration is quite slow, and that's why in a bid to, not waste the vaccines they already have on hand, this is why they're doing this. Would there be another way to get people vaccinated, especially those that don't have access to the internet, to be able to sign up for the online registration systems?
Sean, the other option here is if this will be a first come, first serve, then they have to make the facility a bigger facility so that it can really accommodate as much as everybody that is expected in that particular schedule. No? So it should be as big as they can imagine it. No? Because if you are only doing it in a very small and conventional room and you are allotting like 100 per day or 1,000 per day, and then 1,005 will be coming in unscheduled. That's too much, and that will really be, there's really be danger there of the transmission or not obeying the health protocol. So if the other solution there is put more vaccination centers so that these centers will also be, that area will also be saturated with more vaccination centers.
All right, moving on now to quarantine classifications. Dr. Solante, do you agree with other experts who think that we should actually rethink the easing of protocols so as not to invite another surge in the NCR? Are we really ready to open up our economy further? What do you think?
We might, I agree, if we want to increase the number of people that will be in establishments, like for example, if there will now be relaxation like from 20% to 50%, but no other form of easing the protocols in terms of the face mask, the face shield, the physical distance, including environmental control and ventilation in establishments. That's very important. No? You can put more people, but you still have to implement the health protocol.
All right, the health protocols are definitely going to be here to stay. Dr. Solante, now, the NCR mayors have also unilaterally agreed to adjust curfew hours a bit shorter. Now it's from 12 midnight to between 4 a.m. I'm guessing, based on what you just said, that this is also okay as long as we practice and maintain safety protocols?
Yes, I agree with that. No, but as long as people should always observe, and especially the unnecessary gatherings and parties and other unnecessary gatherings of people should still be implemented.
All right, and lastly, Doc, some doctors have been saying that COVID wards are slowly filling up with patients yet again. I just wanted to ask, what's the situation like in San Lazaro Hospital? Is it getting overwhelmed again, or are things under control at the moment?
We are under control. Our admissions is manageable, and we have not been seeing even a slight increase in cases. So the cases have plateaued to like 40 or less than 40 to something like 30. So we are good with this current situation, and I hope we don't have another surge.
All right, hoping right alongside you. Thank you so much as usual for your time and your insights. Stay safe. Dr. Rontgene Solante, Infectious Diseases Head of the San Lazaro Hospital and a member of the Vaccine Expert Panel.